Kenny, you had mentioned earlier when we were talking that there's a lot of fear in this space. And I love what you said about how fear is tied to innovation or a lack thereof. Tell our listeners a little bit about that.
No, that's exactly what's going on. I mean, COVID has put us in a whole nother level of fear that I've never seen in 18 years. You know, you have patients and family members terrified of what this experience is going to be. You have employees that are trying to take care of these, and they're fearful. Am I going to get COVID from this patient, or am I going to, get really sick here? What's going to happen? And so when there's fear, it just closes everybody up. There's no innovation that's happening. They're just trying to get by the day and get through it and be safe, you know? And so it's really changed the mindset of how we've approached medicine, and there's a lot of fear.
It's a very reactive mindset. I think fear makes us stiff. It makes us react in a way that we're not loose, we're not innovative, we're not fluid. We tend to just be very stiff and reactive. And I know that you as an administrator, living in this reactive space, you're constantly looking for ways to be proactive, right?
Yeah, for sure. And I think with our patients, and it's the unknown, right? So the families, the patients, no one quite knows how they're going to respond to the disease. And so there's a lot of fear, and so more so than I've ever seen in my 18 years of working here. Where people before, when they do have faith and when things are going well, it's amazing how well people heal. They get better quicker. We've seen, when they're laughing, having a good time. Our facility's been known as a place where they have a good laugh and have a good time. And when those things are happening in our facility, the patients heal faster. When they're going down to the dining room, when they're participating and doing those things, it's amazing that they do get better. For 2.5 years, it's been shut down.
Yeah.
And so there's a lot of fear and unknown, and so it's been trying to overcome that has been a huge obstacle.
Well, fear is not something that just affects our mental health. It has physical ramifications as well. This has been studied and proven multiple times.
Yeah.
And we live in that state of fear, especially in the skilled nursing facilities.
Mm-hmm. No, you're exactly right. There's a lot of fear right now, a lot of unknowns. And so, to reassure your staff and make sure, hey, we're going to be just fine. We're going to get through this, and trying to do that, you can't do it enough. I was talking to my director of nurses and just saying, we've got to meet with every member as much as humanly possible to keep that faith going, to keep that drive that we're making a difference in the people we're touching and helping and getting back on their feet. And if we don't, we're going to lose these people forever.
Yeah. Correct me if I'm wrong, the fear is not just with the staff, though. The fear is with patients' families. Is mom or dad being taken care of the right way? The fear is with the administrators because you're fearful of getting hit with a fine when you already have tight budgets. Fear across the board has increased significantly.
No, you're exactly right, and you can sense it and feel it. You can, and it's almost dehumanized us as a society. I feel like, where we just look at each other as just an object.
Yeah,
we're losing that human connection, and in healthcare, that's the number one thing we do well at is take care of people at their worst and get them with that human contact and get them to that next level and help them heal up. But we're losing that, and if we lose that, then people aren't going to recover the way they used to just a couple years ago.
Yeah.